When you're dealing with lateral hip pain, gluteal tendinopathy, some people call it bursitis, greater trochanteric pain syndrome. It's pain at the side of the hip from the glute muscles that come in and turn into a tendon and attach on the bone. And when it gets sensitive, usually that's from an overload, so potentially a big jump in activity levels that your body's not used to. Also, in later years, postmenopausal years, we start losing a little bit of muscle mass, and that changes our whole kinetic chain in that area and just our ability to stabilize our hip. So number one is learning what positions to avoid at first to calm the pain down. And then two is learning what exercises to do to actually strengthen that area and increase the capacity of your hip and your whole lower body. So at first, we want to minimize positions of compression. So compression is when the tendons are kind of being tightened and then pushing down. That's where we get compression. It can make the hip a little bit grumpy. So crossing your legs a lot, certain stretches like figure four or pigeon pose in yoga, and just like a lot of hip rotator stretches. And then lots of standing like I'm standing right now, like jutting my hip out, kind of just like hanging on the passive structures. So in the beginning stages, we want to try to minimize compression as much as we can. We want to stand hip width apart if you're doing something. And then when you're sitting down, just try not to cross your legs. And then don't purposely stretch the hip out. Next, we want to load the area. So sometimes at first, it's too painful to actually work on the lateral hip muscles, which is okay. We're going to kind of just focus on the kinetic chain. The first exercise is a double leg calf raise. So you're going to find a wall, place your hands on it, and then you're just going to rise up and over your toes and down in a nice slow and controlled manner. Try to go up and over your big toe and lower and down, and try to keep the knee pretty straight. And go until you feel your muscles working. That is going to be different for everyone. So you might want to stop at 10 reps. That might be like a really good calf burn for you. You might not feel it until about 20 reps. So just go until you start feeling the muscles working, do a few more reps, and then rest and move on to the second exercise. And the second exercise is going to be a wall sit. So you're going to find a nice clear wall that's sturdy. Ideally, you've got shoes on or you're in bare feet, so you're not going to slip like I'm about to. And then I'm going to just sit back against the wall and hold this position like I'm sitting in a chair. You should feel your quads working. We'll try and hold for about 15 to 20 seconds, and you'll just push yourself back up and move on. Exercise number 3 is a hip hike. What we're going to be focusing on is one leg at a time. Pelvis is level. We're going to try to make it higher on the opposite side. So I'll be working this hip, lifting it up and down. And sometimes that can be hard to figure out. It's like, is the knee bending? No, the knee is straight, pelvis here, lifting and lowering. And it can be nice to use a wall. So from the side, my shoulder's against the wall, this hip is against the wall, and I'm balancing on my right leg. From there, I'm going to drag this hip up the wall, feel that working, lower it to just about level. You don't have to drop all the way down. That's going to potentially be a bit sore right now. So pelvis is level, then I'm lifting up the wall, feeling that squeeze, coming down. So we're just moving about our pelvis. I don't want you to lean with your trunk. So when you're doing it, try not to lean or do anything with your body. It's just your hip is going up and down, up and down. I'm showing you here because another nice way to practice this is a stair. So you can lift, bring that leg down and up and down and up. So there's different ways you can try it, but try flat against the wall. Make sure you feel those muscles working. Try to do about between 6 and 10 reps. Just again, feel that muscle working, kind of go a couple more reps and then rest. Repeat on the other side as well. And the last exercise is going to be an isometric. Grab a yoga strap or a luggage strap or a belt something that doesn't stretch, so not a stretchy band, around your legs, just above your knees. If you have a strap that's kind of uncomfortable, you can just place like a face cloth or a t-shirt there if you're feeling like it's pressing into your legs in an uncomfortable way. Then you're gonna lay down, put a pillow on your knees, and my knees are outside of my hips, so I'm not in a narrow position here. I'm out here. I'm just gonna relax, lay back, and then I'm going to slightly tuck my pelvis, just so I'm not in an arch. I'm in a nice neutral spine. Squeeze your glutes and gently start spreading your legs like you're doing the side splits, and you're just gonna pull out into the band. Pull, 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 pull. Hold for 5, 4, 3, 2, 1, and then relax. Just rest for a few seconds, and then you do that a couple more times. So again, tuck the pelvis, squeeze the glutes, pull out into it. 3, 2, 1, and relax. So that's why I said you might want to put a face cloth or a t-shirt there if you feel like it's getting sensitive. Okay, to sum that all up, we're going to try to minimize positions of compression in the first little bit. So sitting cross-legged, standing on one hip, hanging on it, and purposely stretching out that hip. We're going to try to minimize that, take a little holiday from those positions just to let the tendons calm down. Then we're going to load the area. So we're going to work on our hip hikes and our laying down side splits, adding in the kinetic chain with our calf raises and our wall sit. And then from there, just manage your load. If it's walking that brought on the pain, get back to walking, but maybe don't go every single day in a row. Maybe take some days off so you have recovery, and then do your strength workouts on those off days, and then slowly just ease back into more and more load on that area. Okay guys, I hope that helps. This can be pretty debilitating. I see it all the time, but I will say it will get better if you follow these steps, and if you run into trouble, please reach out to me. Thanks for watching. Peace.